Growing up in New York City is very different for a kid than growing up in the suburbs. What we see with kids in New York City is they spend a lot more time indoors, often living in the tight quarters of an old apartment building. Sometimes there's dust, the walls might have mold. Even getting to school can be very stressful. Just crossing the street can be dangerous. There's so much traffic, it's loud. Of course, there's pollution, car exhaust. Subways are often crowded with poor ventilation. These environmental stressors negatively impact a child's health. As we see in New York City, kids have a lot of respiratory issues. The rate of asthma that's estimated for children under the age of 13 is about 11–12%, which is much higher than the national average. A kid having an asthma attack is going to feel like they're choking or suffocating. Without an inhaler, this very often turns into an emergency situation.
Currently, Healthfirst has over 600,000 pediatric members, and asthma is one of the more prevalent diagnoses that we see. But other conditions are seizure disorders, sickle cell anemia, and type 2 diabetes. Additionally, we serve over 2,000 children with complex medical situations. These are children who rely on machines to breathe, who have to have nursing care in the home. So Healthfirst serves some of the most medically fragile children in New York City.
I'm Linda Thomas. I'm a member of Healthfirst. I have 3 children on the autism spectrum disorder. Jaden is the one who sleeps in the safety bed. Anytime the bed is broke, Melody reaches out to the bed company and she advocates for my son. Any concerns, any questions, she's there, and I need support sometimes.
I've worked with Linda and the boys for over 2 years. If Jaden's safety bed doesn't work, he's at risk of, roaming the apartment, turning on the stove, could potentially cause a house fire or leave the apartment into traffic and hurt himself. Imagine as a parent having to worry about something like that. And if he doesn't have this bed repaired, this could be something that, poses an extreme risk for him.
One of the best things about Healthfirst is that we are super innovative with how we try to approach a health problem and help our members.
Hi, how are you today? My name is Cassandra. I'm a registered nurse care manager here at Healthfirst.
We have a team of care managers who will call and facilitate anything that they can for the family.
On a monthly basis, our pediatric care management team is outreaching 10,000 to 12,000 children. When we outreach a family, we're initially going to identify the need, what the doctor ordered. We help get the supplies ordered. We help make the referrals to the specialists. We provide education to the parent, and at the end of the day, it's small steps that get us to bigger impacts. Even if it's something as simple as a conversation with a parent who didn't feel like they were heard, that parent's gonna sleep better tonight because of something that pediatric care management did at Healthfirst.
As always, should you guys need anything, we're always here for you. Thank you.
Have a great day.
As a pediatrician, I loved working with my families one-on-one, but I came to Healthfirst because now I can have a bigger impact and really think of ways to improve the lives of these children.
Kids should be able to have fun. They should be able to enjoy themselves and play. The last thing they need to worry about is their health care. And so the pediatric care management team is here to help them with their health care needs.